Monoclonal gammopathy iStop trial, which is done in Iceland and still ongoing, has really put a spotlight on how do we monitor MGUS patients. The biggest challenge I see with having a monitoring program for monoclonal gammopathy is having a system set up in-house to monitor monoclonal gammopathy patients longer term. And that's what we've done in Oxfordshire. We've been working with our integrated care support team in the community who have funded us to enable a monitoring program, which in short we call OxCOM or OxCOM, which is Oxford Community Monitoring. And we consistently see 800 new patients with monoclonal gammopathy every year. And in this particular abstract, we've highlighted the program that we have set up and how this has been successful in delineating patients who are low risk, intermediate, and high risk. We find that low risk patients comprise close to about 75 to 80% of patients, and these patients are safely monitored through a laboratory-based monitoring system supported by a hematology administrator. This essentially keeps this group of patients outside of the hematology case workload, which is increasingly taken up by newly diagnosed myeloma patients and relapsed myeloma patients. And we have a nurse monitoring for the intermediate risk, and you have a clinician monitoring for the high risk. In this poster, we have presented that this particular system is able to ensure that over 95% of people can stay monitored over a 2-year period, and progressions to active myeloma are actively captured using this monitoring system. So we are proposing this, what is a very cost-effective, high-throughput model of MGUS monitoring should be considered by other ICS boards in this country in coalition with the local hospitals.